the case of total anomalous pulmonary venous connection of supracardiac variety. In this image, what you see, this is bicaval view. Bicaval view means you can see the IVC and SVC turning into right atrium. So in this view, what you see, this is the IVC is quite collapsed compared to supravena cava. Supravena cava size is much more than IVC. It means supravena cava is draining some other structure also. This is left atrium, this is right atrium, this is right pulmonary artery, and this is SVC. Again the same thing, you can see the same image. SVC size is much more compared to IVC size. So now you see, this is a supraesternal view. In supraesternal view, you can see the aortic arch. This is aortic arch. This aortic arch has the flow. This is blue flow. That means descending part of aortic arch has blue flow. At the same time, you see the left of this. Though it is right of your hand, right side of your image, but for patient wise, it is left of the image. This is aortic arch, and this is the left portion of the patient, this is the right portion of the patient. So ultimately left to descending aorta, you see the red flow. The red flow means any flow that is going towards the probe. Probe is in supraesternal position, so it is flow is going towards supraesternal. So this is a straight vein, and this is joining the left innominate vein. You see this in this image. This is a straight vein joining left innominate vein and making arch like, so arch above the arch. In supraesternal view, what you see, the arch above arch, and the direction of flow is opposite of that normal aortic arch. So that is the case where you see this is supracardiac variety of total anomalous pulmonary venous connection. So what happens in total anomalous pulmonary venous connection? All pulmonary veins joins to make pulmonary venous confluence. From there, one straight vein originates, and that goes superiorly and joining left innominate vein. So this is the straight vein, the red flow, and that is joining the left innominate vein. Left innominate vein and right innominate both join together to form superior vena cava. You see this, the blue flow is superior vena cava flow. So arch above the arch, flow wise opposite of that of normal aortic arch. That is the scenario you see from supraesternal view in case of total anomalous pulmonary venous connection, where the all four pulmonary veins making pulmonary venous connection, then a straight vein is joining left innominate vein. Finally, all pulmonary veins draining into left innominate vein. That is the point to know. See the image wise. You see the blue. This is the blue flow, is the red flow. Again, you can see arch. The blue flow is supravenacal flow. You see this directly supravenacal also. Even more than that of aorta. Simply I am freezing the image to show you. You see the size of supravena cava is this one, that 8 millimeter, and size of aorta is only 5 millimeter. Normally what happens, the size of aorta is more than that of supravena cava, because supravena cava is blood is holding the blood only from the upper part of the body, but aortic arch is holding all the bloods that the whole body has to get. So ultimately the size of aorta is always more than that of supravena cava. So whenever you see the supravena cava size larger than that of aorta, it means supravena cava is abnormal, is getting some sort of abnormal supply. That is the case in this image. Again the same thing you can see. This is aortic arch, this is aortic arch, and this is abnormal flow. That is the straight vein joining the left innominate vein. This is the supravena cava. The blue flow, this is supravena cava. Little bit red. Just want to show you the red flow. You see this red flow. This is the flow in the ascending aorta. This is red flow. Red flow means that is flow is going towards the probe. That means supraesternal probe. So this is ascending aorta. This blue flow is flow in the supra cava. So blue in colors means blood is going away from the probe. Probe is in supra-sternal position, so going inferiorly. So vena cava blood flow is inferior direction. Inferior vena cava has blood flow in superior direction. Again you see the same thing. Aortic arch above the aortic left innominate vein and joining the supra vena cava, making arch-like finding, that is abnormal communication of total anomalous pulmonary venous connection. You can see the IVC is slightly dilated compared to aorta. This is the left atrium, right atrium, and ASD. You can see this is ASD. This image ASD. This is pulmonary venous confluence. Pulmonary venous confluence just superior to left atrium. This is fourth chamber view. You can see. You can see the left atrium, left ventricle, right atrium, right ventricle, right atrium, right ventricle always dilated in case of total anomalous pulmonary venous connection. Why? Because all pulmonary veins are draining into right atrium. At the same time, IVC and SVC also drain into right atrium. So right atrium gets all the bloods from both pulmonary vein and systemic vein also. So ultimately right atrium and right ventricle gets enlarged. You cannot see the left atrium is quite a small compared to right atrium. At the same time, ASD is the only communication between right atrium and left atrium, and superior to left atrium because the probe is in apex. At apex is the lower part of the heart. So this is the lower part of the heart. Upper part of your skin image is the lower part of the heart, and lower part of your skin, the image, is the upper part of the heart. So this is superior to left atrium is pulmonary venous confluence. You see this aorta in transverse section, that is just posterior to left atrium. So this is the case of total anomalous pulmonary venous connection. Whenever you see the size of left atrium very small, not getting any pulmonary vein into it, at the same time you get any some sort of chamber that is just superior to left atrium, that is pulmonary venous confluence, that is indicates that this is the case has got abnormal communication of pulmonary vein. That is the point to know from this video, this image. Again you see the pulmonary venous confluence. Pulmonary venous confluence means all four pulmonary veins drain into and make one chamber. In that chamber all pulmonary veins drains into, and from there a straight vein comes and that joins left innominate vein. This is apical fourth chamber view. So upper part of the skin indicates lower part of the heart, and lower part of the skin indicates upper part, superior part of the heart. Thank you. So whenever you see, one thing also important, this is aortic arch and this is descending part of the aortic arch has blue in flow. In that normal flow, the blood is going away from the probe, that means from arch it's going into descending aorta. So whenever you see any flow that is just beside, that is just left to this descending arch and that has got red in color, that means always that is abnormal pulmonary venous communication. If blood flow is blue in color, that means maybe likely left side is vena cava, but in that case it will not be that much enlarged. That much flow, there will be no that much flow. This much flow is always when large flow, high flow, more flow is always indicates abnormal pulmonary venous communication. At the same time, it has to be opposite of that of the color wise. The flow direction has to be opposite. Color opposite means flow direction is opposite. So whenever you see opposite flow direction, opposite color, then it is abnormal pulmonary venous communication.